Recording. All right. Good afternoon, everyone. Thanks for joining our policy briefing today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY campaign. As always, our goal with these briefings is to make sure that you get the latest information on the state and federal response to COVID-19, updates on our safety net programs, and opportunities to educate and advocate. We'll try not to repeat too much since we've been doing these on a monthly basis, but what we want to do is really tell you what's changed in the past month and what we're anticipating for the future. And by this time, many of you should be familiar with our ThriveKY campaign. I hope you are. But if you're joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And you can see our shared principles on this slide. We strongly believe that the only way for all Kentuckians to thrive is through anti-racist and anti-poverty policies that will lead to a more equitable and just Commonwealth for everyone. So during these presentations, we try to touch on what those policy solutions look like. These are the committee members, the steering committee members for our campaign. And many folks are representing, many of our speakers today are representing these organizations. We can go to the next slide. And this is our agenda for today. So our members of the ThriveKY campaign will be speaking on their areas of expertise. Before we begin, I just want to do a little bit of housekeeping. We always record these webinars and we'll provide them in a follow-up email, a link to both the recording and to the slide deck. And so if everyone could be sure to mute their lines, that would really help. We also will take questions and comments throughout, so you can use the chat box and we'll try to get to those as they come in. And there's one other thing I'm forgetting. If we are now offering CEUs for certified community health workers and for licensed social workers. So if that's you and you'd like to get credit for attending this webinar, you can contact Angela Cooper after the webinar and she can make sure that happens. So with that, I'm going to turn it over to Dustin to do our economic overview.
Thanks. Well, you know, like we've said in the past, I think we are really in unprecedented times, and a lot of what we're going to discuss today as far as what types of policy are needed to really help people stem from our economic reality. So we wanted to just give a snapshot of where things stand right now, which is shifting sand, as everyone knows. So we wanted to kind of start out with a picture of what's been happening with jobs. I know, you know, we hear in the news every day that more and more places are reopening and that the economy, maybe in fits and starts, is, you know, moving back toward a more sort of robust level of activity. In terms of people being hired back, you know, there was a pretty immediate bounce back after the initial drop in jobs. But because the initial drop in jobs was so enormous, over 300,000 Kentuckians, even though we've regained, you know, quite a bit of that, we're still 156,000 jobs short. You know, today, or actually that should say July, not May. That's a typo on my part. You know, there were 1.8 almost million jobs in the state, which again is still pretty significantly below where we had been after a really impressive run of job growth following the Great Recession. And, you know, currently we are about 8% below where we were in February. So, you know, these are a lot of folks who may be laid off temporarily and they anticipate going back. But on the national level, more and more we're finding that what are considered permanent layoffs are on the rise. And that's really concerning because, you know, folks who are completely detached from their previous place of employment, it's a lot harder for them to get back in the workforce. So let's move to the next slide. What we're also finding is that the layoffs and furloughs are not proportionate when it comes to race. So, we know for years now that Black Kentuckians have had a higher labor force participation rate, meaning, a larger share of working age Black Kentuckians tend to work than, people of other races. And yet, using monthly unemployment insurance data, we know that they are more likely to have been laid off during this downturn. That's due to a lot of reasons that stem from a long history of cultural, economic, and political barriers to the type of opportunities that we would want to have. But the truth is that 9.8% of Black or African American workers are covered by employment, meaning their employers pay into it, but 16.2% are claiming it right now because they lost their job through no fault of their own. Whereas white Kentuckians, it's the opposite direction, about 5 percentage points lower claims compared to the number that are covered by unemployment insurance. So this is an issue. This is a real issue in terms of equity, but also just in terms of, making sure that when recovery does really begin, we make sure we have an equitable recovery that, as Emily says, really has anti-racist outcomes and not re-entrenches the type of systemic barriers that we've seen up till now. So let's go on to the next slide. So this is my last slide for this. We've talked about jobs. Obviously, jobs and wages are connected. It's also true that a lot of folks who were not technically laid off lost hours. Think about somebody who was working full-time as a server at a restaurant, and then when the restaurant closed to in-person services, moved to part-time doing carry-out. And there's a lot of different examples I'm sure folks can think of, but what we've seen is that, about half of Kentucky adults report losing income in their household. And that number is more than half for households where there are children, low income households, households where there are Black Kentuckians, and households where there are Hispanic and Latinx folks. There are a lot of reasons for this. We mentioned job loss and a reduction of hours, but also a lot of really important policies that have helped us up till now have expired, including the pandemic unemployment compensation, or that $600 per week unemployment benefit, which expired at the end of July, over a month ago. Stimulus checks have largely been spent. There are still some trickling out from the initial round, but those are largely out the door and have largely been spent by now. And then, of course, we know, too, that Kentuckians who are Black and Kentuckians who are Hispanic and Latinx have less money to fall back on. And so a lot of people's savings have also been dried up by now. And so this chart on the right, this yellow line, we'll come back to it later because I think it's so important, but it represents consumer spending. And as you can tell, when we initially shut down the economy there, end of March, beginning of April, there was a huge slide in spending. Right there at the trough where it sort of flattens out, that's when the unemployment benefits really hit and started hitting people's bank accounts, which stopped the bleeding. And then that bounce back is when stimulus checks really started being received. And so we had a really nice slow climb back up to what you might consider normal levels of spending. And since then, we've had sort of a tumultuous decline that unfortunately is smoothing out and trending downward. So we need to, I think, be aware of that. I think, this really highlights in my mind the need for significant intervention on the part of the government to provide aid, not only to state and local governments, but also directly to the folks who need it. So that's what we're going to spend a lot of time talking about during the rest of this presentation. So with that, I will hand it back.
Good afternoon. I'm Sheila Schuster with the Advocacy Action Network, and I want to talk to you today about probably the single most important activity that you can take as a citizen of the Commonwealth, and that is to vote. So we're going to talk today about elections and your various voting options. Next slide, please, Angela. Thank you. So first of all, who's on the 2020 ballot? You're already seeing the ads. We just came out of the Democratic and Republican national conventions. So we do know that we will be voting for the US president and the vice president. We also, and you probably have seen these ads as well, we have one of our 2 US Senate seats in Kentucky is on this ballot, and that is of Senator Mitch McConnell, who is challenged on the Democratic side by Amy McGrath. All 6 of our Kentucky seats in the House of Representatives, we have 6 congressional districts in Kentucky, and all 6 of those seats will be on the ballot. And then if we turn our attention to the Kentucky General Assembly, or our legislature, we have 100 seats in the House, and of those 65 have contests, which will be on the ballot in November. And those are 2-year terms in Frankfort. Of the 19 Kentucky Senate seats, it's all the odd numbered districts, so that's half of the senators whose 4-year terms are up. 12 of those have contests that will be on the ballot. I would also point out that you may have some local races, your local city councils and so forth may be on your ballot, so be sure to look at the entire ballot. Also on the Advocacy Action Network webpage, we have a listing by county of every single legislator and challenger in the 120 counties. So you could look there to see if you have a race in your county. Next slide, please, Angela. So the first thing you have to do is to be sure that you're registered to vote. If you were able to vote in the primary, and you remember that the primary was changed from May to June, and nothing has changed, that is your address is not changed or your name is not changed, then you don't have to re-register. You can go to www.govotekentucky to check your registration actually, or to register for the first time, or to update your registration. And let's be very sure that we're letting people know the deadline for doing that is 4 p.m. local time on Monday, October 5th. So that's about a month out from the actual date of November 3rd for the general election. So first you have to be registered and be sure that you are. Second, you have many choices to decide how you want to vote. You will remember in the primary that we had a bipartisan agreement between our Democratic governor, Andy Beshear, and our Republican Secretary of State, Michael Adams. And most people voted by absentee ballot. In fact, it was the #1 way for people to vote, and we had the highest turnout in the primary that we've had in any primary for over a dozen years. So the option to vote by absentee ballot is available, and you can request your ballot now. They also have extended for several weeks the option to vote in person early, and that starts on October 13th and ends on November 2nd. And then you can also vote in person on Election Day, which is November 3rd. I would just remind you that elections have consequences and your vote can make a difference. You may remember in the last 2018 elections that there were several House seats that were decided by fewer than 20 votes. So when people think that their vote doesn't count, one of them was actually decided by 1 vote, and then they decided it was a tie. So think about how many people decided not to vote in that election and could have swayed the decision one way or the other. Next, please, Angela. So let me give you a little more detail about voting by absentee ballot. You request your absentee ballot again at that same website at www.govotekentucky.com, ky.com. And they will give you 5 or 6 different reasons for you to be making the request. One of those includes that you are concerned about contracting or spreading COVID-19. You don't have to choose among those. You simply check the box at the bottom that says, I want an absentee ballot for one of these reasons. And then you continue to the next pages. It's very simple. It's very straightforward. They really walk you through it. You have to enter, of course, your identification and date of birth and social security number, so they're sure it's you, and so forth. You can choose the address to which you want your absentee ballot to be sent. That portal is open now, and it will close at midnight on October 9th. It's possible that you can request an absentee ballot from your county clerk after that, but that's not entirely clear to me. The absentee ballots that you request on the Go Vote Kentucky website will be sent to you beginning in mid-September. Now, you know there's been a lot of controversy about the U.S. mail and whether the mail is going to get picked up and delivered on time. If you fill out your absentee ballot as soon as you get it, put the postage on and put it in the mail right then, it's probably safe. But if you want to be absolutely sure, there will be designated secure drop-off boxes in each county where you can safely deposit your ballot. We do not have those locations yet, but we will try to make that information available on our various websites. Absentee ballots must be postmarked no later than November 3rd, received by November 6th. I cannot emphasize enough how important it is to follow the instructions. We had actually thousands of primary ballots that were thrown out because the directions were not followed. So you need to mark your choices very clearly. Then you need to sign both the inner and the outer envelopes, and there's a flap there between the two that you need to keep attached, and then seal the outer envelope. So be sure that you've signed it in two different places. I think there are some organizations that actually have a short video available to show you how to do that, but just be sure that you follow those instructions. Next, please. If you decide to vote early, you can begin that on October 13th, ending on November 2nd. You do not need to make an appointment to do that. Some county clerks under the old system would require you to make an appointment to come if you were going to vote early. That's not necessary. We believe that the voting locations will be open Monday through Friday from 8 a.m. to 4 p.m. We know that they will be open for 4 hours on the 3 Saturdays in October that immediately precede November 3rd. So that's October 17th, the 24th, and the 31st. So watch your daily newspaper, watch your media outlets to see what the hours are and what the locations are. You remember that in the primary, there was only one voting location in most counties, and we ran into a lot of problems where people couldn't get there in order to vote that day. There will be at least one supercenter voting location in each county where all the precincts can vote, but there will also be other locations available. And again, watch your local media to find out what those locations are. They will be exercising the mask requirement and also keeping social distancing. In person on election day, that's November 3rd, the polls will be open from 6 a.m. to 6 p.m. in locations to be announced in each county. Again, there will be more than one voting location open in each county. They will require a mask and they will ask for social distancing. In the last General Assembly session, the General Assembly passed a requirement for an official ID that had to be issued and that you had to show in order to be able to vote. That requirement has been loosened due to COVID because those offices are not open. If an individual does not have a picture ID that they consider to be an official one, like your driver's license, you will be asked to sign a paper indicating the reason why, and you will still be able to vote. So insist on your ability to vote. If your ability to vote is challenged, you can ask for a provisional ballot, go on and vote, and then check back with your county clerk or election official to make sure that your vote counts. So you have three options again: absentee, in-person early voting, and then again voting on election day. The most important thing is that you get out and vote. Next, Angela. I want to talk briefly about behavioral health issues, and I want to thank Marcy Timmerman, who's one of our Thrive Kentucky partners from Mental Health America of Kentucky. Next slide, please. I just want to remind us all that everyone is feeling anxiety and probably a little depression. We really are dealing with two pandemics right now, and the pandemic is all-encompassing. It infiltrates and affects all aspects of our lives. So one, of course, is the physical COVID-19 virus, and the other is the pandemic around racial injustice and intolerance. Both of these present significant mental health challenges, and we may feel it differently and express it differently. Some people will react with withdrawal, some people will act with sadness, some will act with anger, some will eat too much, some will eat not at all, some will sleep the days away because they're so painful, others will not be able to sleep at all, but all are expressing some varieties of anxiety and depression. We are seeing more calls to the crisis helplines, more overdoses, more suicide attempts during these pandemics. So Marcy and I are here to remind you that there are some things that you can do. One is to get daily exercise, walking, bicycling, jogging, moving your arms and legs, walking around your house will release endorphins that will help your brain function and make you feel better. Stick to some routine every day. Make yourself a little agenda or note or list about how you're going to spend the day. Minimize alcohol use. Alcohol is actually a natural depressant. And if you are depressed and anxious already, it's not going to help. Reach out and connect with others. The more that you connect with others, talk about how you feel, and talk about what you can do to help. Actually, helping somebody else is a great antidote to your own mental health struggles. The local community mental health centers that have services in every county are open for services via telehealth. Many agencies and many private providers are available. So reach out for those services. If you are feeling suicidal, please call the Prevention Helpline. Help is available immediately at 1-800-273-TALK. So just remember that what you are feeling is not unique to you. There are others that are feeling the same way. Sharing with others is helpful, and do reach out and get help if you are feeling especially overwhelmed. Thank you, and I'll turn it over on evictions and housing.
Talking about depression is a natural predecessor to talking about evictions right now. It's a depressing landscape out there, everybody. My name is Ben Carter. I'm an attorney with the Kentucky Equal Justice Center. And I put a couple of links in the chat. We're going to be talking about evictions for about an hour tomorrow at 1 o'clock. So this is just going to be the Cliff Notes version of that. And there will be some locked content that you can only unlock by coming tomorrow at 1 o'clock. So you can register at that bit.ly link, and I'll show you kyrenterhelp.org today. Okay, first slide, or next slide, let's say. Let's talk about 3 bad things that have happened in the last month or so. First of all, the court announced in late July that it was going to allow evictions for non-payment of rent across Kentucky starting August 1st. It's one thing to tell people that they're facing eviction for non-payment of rent in a pandemic. It's a whole other thing to tell them that they can face that eviction within 4 days of your announcement that you're opening up the courts for evictions for non-payment of rent. So that's the second time that the court has changed the rules for home renters with very little notice. They changed the rules in late May, allowing evictions for reasons other than non-payment of rent with just a few days notice back in late May. So very frustrating development. As Dustin mentioned, the pandemic unemployment compensation expired at the end of July. And a lot of people across America were using that assistance as rental assistance. And so what I say here is September 1st is going to be very ugly. It's going to be dangerous, and less dangerous now because of the governor's recent executive order, which I'll get to, but we have not begun to see the struggles that people are going to have in paying rent because the pandemic. Unemployment compensation, frankly, was a very helpful lifeline for home renters. And then finally, the CARES Act properties are now subject to eviction starting August 24th. So those are sort of three things that build upon one another to suggest that we haven't really begun to see the volume of evictions that could be possible in Kentucky and in other parts of the nation without further protections, right? And so one good thing that happened last week was Governor Beshear issued an executive order effective August 25th requiring a 30-day notice from landlords before they can file an eviction for non-payment of rent. Importantly, that does not apply if the landlord is claiming some reason unrelated to non-payment of rent. So it really incentivizes the landlord to be creative with whatever reason they want to come up with. You know, you're not allowed to have chickens in your backyard. You have one too many cars parked in your driveway. You have somebody living there, whether it's a dog, human, cat, that's not on the lease. And that's why I'm evicting you. So that's an issue to look out for. Let's go to the next slide. Just some more, I'm not sure whether this qualifies as doom scrolling or not, but some more bad graphs to present you all with. But it just shows just how useful that $600 per week payment was in helping people make their rental payments. So with state unemployment and $600 a week, there were about 1.28 million American households paying more than 50% of their income on rent. We're now down here in this area with state unemployment insurance, but nothing else. I know that there's going to be some form of $400 a month or $400 a week for a few weeks, but the important take home here is that without any additional unemployment insurance money from the federal government, this number goes from 1.28 million to 3.48 million. So significant rise in severely cost burdened households. And again, that's households, not individuals. So we're talking 4 people, 5 people facing evictions. Let's go to the next slide. And similarly, this just goes to show that for most of the low wage workers, the unemployment rate is a lot lower or a lot higher, I should say, than it is for people making $20 an hour and above. So those are the last folks to see a recovery and probably the most likely folks to be home renters during a pandemic. So again, a real sense of doom in this area. Let's go to the next slide. Because of all of the changes to the eviction rules, what we really have are 4 different phases of evictions currently pending and that we will see in the court system in the coming months. We have those evictions that were filed before the pandemic that were put on hold during the pandemic. Those are being processed right now. We have evictions for reasons other than non-payment of rent. Those were filed starting on June 1st. Then there's this odd period of time when the courts were open for evictions for non-payment of rent, but before Governor Beshear stepped in with his executive order, this period of August 1st to August 24th, all of those people are facing eviction now for non-payment of rent without the benefit of that 30-day notice, okay? And it's my understanding that courts are treating those cases differently. Some courts are allowing those to go forward without the 30-day notice. Other courts are putting them on hold to give landlords time to provide the 30-day notice. So then the 4th category will be these evictions that get filed once landlords are able to provide the 30-day notice that Governor Beshear's executive order requires, okay? So presumably on August 25th, when that executive order became in effect, there weren't very many landlords had issued a 30-day notice to their renter that included a meet and confer invitation, right? Part of the executive order is your notice needs to include an invitation to meet and confer with the landlord to work out a rent repayment agreement, apply together for rental assistance, whatever it might be. While some landlords might give 30 days notice, I doubt very many at all invited their renter to meet and confer with them as required by the executive order. So we have this small window of time from August 25th until, let's say, September 24th, where landlords are going to have to issue this 30-day notice before filing in district court across Kentucky. So a small reprieve right now, which is going to be very useful to get rental assistance programs up and running, to do outreach to renters, get them connected to lawyers, all of that stuff. So what we always say is everybody in this situation needs more time. Governor Beshear needs more time to close out the backlog on unemployment insurance claims. As Adrian will tell you, local governments and agencies need more time to roll out rental assistance programs. As far as I'm concerned, the courts need a lot more time to build out eviction processes that are safe, fair, and uniform across Kentucky, because what's happening right now is the Wild West. And it's not fair to renters who are struggling with 120 different local rules on how evictions are processed. And it's not fair to the attorneys on this call who are trying to advise people on what to do, what to expect, and things like that. And not just attorneys, obviously there are other people who are working with home renters right now as well. Let's go to the next slide though, Angela, and I'll sort of show you the impossibility here. Oh, my emojis did not translate. The emoji that lives most often in my frequently used tray these days is the white man who's holding his hands up like this, sort of saying like, I have no idea what's going on, right? And that's the emoji that didn't quite translate there. But you have a really steep hill to climb if you want to provide any sort of guidance to home renters in Kentucky right now. You need to know when the eviction was filed. Is it a pre-pandemic eviction? Is it a small window of time between August 1st and August 24th eviction? Where do you live? Depending on whether your local county or local city has adopted the Uniform Residential Landlord-Tenant Act, your rights are going to be different than other people's rights across Kentucky. Do you live in a covered dwelling under the CARES Act? A lot of landlords don't know whether you live in a covered dwelling under the CARES Act, and it can be very difficult to determine that. What rental assistance is available in your community? Louisville has rental assistance programs available now. It's my understanding that almost every other jurisdiction does not, and that changes things. And then over all of that, we have rules that change with almost no notice. And tomorrow, there's going to be a hearing and oral arguments in a federal court case where landlords in Northern Kentucky have challenged the legality of Governor Beshear's eviction protection. So everything could change with the stroke of a pen from a judge in Northern Kentucky. So if you're confused, if you're frustrated, if you're feeling like you're having a hard time keeping up with what's going on in the eviction process in Kentucky, let me tell you, it is literally a full-time job to keep track of all this stuff, unfortunately, right? It should not be this hard to be able to tell people what to expect when facing eviction. So let's go to the next slide real quick, Angela. So I'm going to give you one tool and one area for more info, and we can go to the next slide. KYRenterHelp.org is a tool that KEJC built, and then the link again in the chat for more information tomorrow following that oral argument and evidentiary hearing in federal court. We'll be talking sort of short-term problems as well as building power over the long run, because where we're ultimately going to go is home renter rights are going to be on the line in the General Assembly in 2021. And we have the task of building power with and among home renters very quickly under difficult organizing circumstances. So we're going to be sort of doing short-term stuff and long-term stuff on that call tomorrow. But let's talk real quick about KYRenterHelp.org. I know I'm going fast, but not fast enough. And I'll try to end this soon. So we built this for 3 different groups of people: lawyers who want to help in this pandemic, represent people who are facing eviction, home renters who are facing eviction, and allies. So in other words, we built it for almost everybody except landlords, right? And the idea here is that everyone can do something to help avoid unnecessary evictions. Let's go to the next slide. This is sort of a landing page for the application. And it's, again, it's for renters who are facing eviction, lawyers helping renters, and allies who want to help protect people from eviction. And the application does a number of different things depending on which kind of user you are. For home renters who are facing eviction, the real takeaway message, I hope, that we deliver in this app is you need help, contact your local legal aid agency. There are 4 legal aid organizations across Kentucky who are trained and ready to help provide eviction assistance, eviction defense, right? And we use some tools to help connect those folks. And then if you're an ally or you're a lawyer, we give you some other options, like give us your email address so that we can help you email elected officials when it comes time to stand up for home renter rights and things like that. We understand that not everybody is going to be able to make it to a lawyer. And so we also give people the option of preparing legal documents that will answer the eviction complaint and do one other thing that we think is very important, which is demand a jury trial. If the advice that we're providing is that every renter facing eviction should be asking for a jury trial, because there are lots of issues of fact that we don't know, like, is the landlord subject to the CARES Act, for example, that you can only find out through a jury trial. The court has said no jury trials will happen until October 1st. So in the time that you have in between now and the jury trial, you can apply for rental assistance programs that aren't yet available, try to find a lawyer, et cetera, et cetera. There are a lot of reasons to request a jury trial. And when I say request, what I mean is demand. You have a statutory right to a jury trial in Kentucky, and you can demand that on the day of your eviction hearing. And so it's trying to empower people to sort of step into that and insist on the court scheduling a jury trial so that they can have a jury trial, and also so that they can have time to work things out with their landlord, et cetera, et cetera. So, so that's sort of what the app does. Let's go to the next slide. I'll show you the first page of it. We ask you 2 questions as a user. Oh shoot, you can't even see this. I screwed it up. Well, this slide is supposed to show you a drop-down menu where you tell us what county you live in. And then as you scroll down, the next question is, which one are you? Are you a lawyer, a home renter, or an ally? And based on those answers, we're going to give you information and ask you additional questions. So the first page you would see if you told us you were a home renter from Leslie County is we would be able to generate this information in the first and second paragraph here, explaining that the local legal aid organization serving Leslie County is Apple Red Legal Services, right? We just draw that from a table that we've uploaded to this app that has all the information, like what the local organization is, what their phone number is, along with, you can see further down on this page, we give you the name of your local circuit court clerk. So if you need help, or if you need to reschedule your hearing or something like that, or need instructions on how to attend remotely or something like that, you have their phone number, an elected official that you can call and get more information from. And it's that sort of stuff that we sort of try to guide people through. But again, I want to be very clear. And if you scroll down on this page, one of the things we tell people who are home renters is, if you want to just stop right here and call legal aid, that is totally cool with us. Like, that would be the #1 best thing that you can do. If you do want to keep going and prepare these documents, that's fine, but really call legal aid. So So this is an imperfect tool for a crisis. I wish I had 48 hours every day to build out functionality and spin up features more rapidly than I have been. But I think if nothing else, being able to tell people you need to get connected to legal aid, go to kyrenterhelp.org, tell them the county that you're in, and then you get one page of information that they can then act upon. So that's the goal of that. And I would encourage everybody on this call to go and check it out, fill it out as an ally and say, hey, I'm here for the fight. I want home renters across Kentucky to have safe, fair, and uniform procedures if they're facing eviction. So kudos to Governor Beshear for doing the 30-day executive order. I want to be clear that that was very important. And the notice requirement is super important for people to have. One thing people don't understand who aren't in this world is that evictions happen at lightning speed. And the cost of an eviction in terms of destabilizing a family's ability to secure housing in the future has never been higher. With the advent of credit reporting services and tenant background checks, this is not, you know, the 1970s when the Uniform Residential Landlord Tenant Act was created. Housing is much scarcer now. It's more expensive now. And one eviction can destabilize a family for an entire generation in terms of being able to secure safe and affordable housing. And so, so we have a lot of work to do. The stakes are extremely high, but the people on this call are the people to do the work. And I'm glad to have everyone's attention and work on it because everybody can do something. I think that's my slides.
Hi, everyone. This is Adrienne Bush with the Homeless and Housing Coalition of Kentucky. And just a reminder of what this actually means, all of these complicated court process and procedure issues, is that keep in mind, we have a number of renters who are in low wage jobs. We have a number of Black Kentuckians who rent, and so this crisis will disproportionately impact Black Kentuckians. The estimate from the firm Stout Rizius is that 48% of renters are at risk of eviction over the next 4 months. Next slide. So I was on a call yesterday and I thought this data point was interesting. The National Housing Law Project has been analyzing 211 data. Here in Kentucky, we do not have a statewide 211 system. So this data is pulled from the Louisville metro area. But I think it's important to note that of all the 211 calls in that area, the largest share by far is for housing and shelter. And of those housing and shelter calls, 64% is for rent assistance. Next slide. So here's what is available kind of right now. Statewide, there's a big asterisk next to it because by statewide, I mean 119 counties out of 120. All counties except for Louisville, Jefferson County. The governor, as part of his executive order, did allocate $15 million in CARES Act coronavirus relief funding. This is being frantically worked on by folks in the governor's office and the State Housing Finance Agency, Kentucky Housing Corporation, with an anticipated application portal date to open up on September 9th, okay? So the application does not exist yet. I mean, not publicly anyway that I know of, but theoretically this will be opened on September 9th. In Lexington, the Lexington Fayette Urban County government has made just under $1.5 million in emergency solutions grant and community development block grant funding available for housing relief. To try to access that pool, we encourage you to visit the link below. Next slide. In Louisville, we know that $21 million of rental assistance was designated in July. The application portal for people experiencing hardship is stopmyeviction.org, and that link is there. I want to talk briefly about the other 118 counties. The Kentucky Housing Corporation did receive what is called Emergency Solutions Grant funding through the CARES Act to distribute. This money can be used for rehousing people who are literally homeless. And we estimate, based on KHC's plan submission to HUD, that about $10 million of that will be available to regional providers, although again, it's not available yet. And then for shelters across the 118 counties, they can now seek reimbursement or grant funding for all of the increased costs they've had over the past 4 or 5 months in providing motel vouchers, increasing their capacity, increased costs for operating a socially distanced shelter. Next slide. Okay, and then to hit home one final time, hopefully I'll never have to talk about this again. What is missing from the HEALS Act and the skinny bill proposal that is under consideration theoretically next week in the Senate is a nationwide uniform eviction moratorium. Right now, what we have in Kentucky is extremely not uniform, extremely unfair, and extremely inconsistent. And unfortunately, Kentucky is not even the only one in this situation. People are having problems all across the United States. The second thing is we need to just print the money, as my colleague Ben would say. We just need to keep the money flowing. It will take, a conservative estimate is $100 billion. The longer this goes on, the more expensive it gets. And the third is $11.5 billion, because again, I forgot the B, in emergency solutions grant funding to address the projected needs of people experiencing homelessness. Although we are in the middle of summer right now, winter is coming. And that means that we are facing not only COVID-19, we're facing the flu, we're facing colder temperatures, we're facing hypothermia. And so unless we get a handle on this now, we are going to need additional money to help keep people from dying in the middle of a pandemic on the streets. I believe that's all of my slides. Next slide. Okay, I'll turn it over to Dustin Hugel with KSEP.
Great, and I will keep the just print the money train going. So let's move on to the next slide. So I have to apologize. These numbers are accurate, but they are old. So I will try and give some more accurate or more up-to-date numbers as we go here. But, you know, we thought it would be important just to kind of continue to give an update on unemployment insurance, as it is something that a large share of our workforce is continuing to use to get by on. And I just want to clarify, you know, when we're talking about folks who are drawing claims through unemployment insurance, we're talking about both people who are not working and people whose hours have been reduced and so are eligible for a smaller benefit. So, you know, this 16,000 new claims, which is an up-to-date number, you know, some of those folks are folks who have completely lost work, and yet many of them are also folks who are underemployed as well as unemployed. So, you know, the downturn is still taking a significant toll on our economy and our workers, and it sort of manifests in different ways. The bar chart here on the left, I think people will recognize, you know, those small blue bars on the left-hand side are not an error. Those are the weekly claims between the beginning of the year and the middle of March. And then when cases started to appear and we began shutting down the economy and frankly, people stopped going out, the unemployment claims shot up to a peak of about 117,000. Since then, they have been tapering off. But to have 16,000 additional people filing a claim, 2 weeks ago, that is a really significant number. At the worst week of the Great Recession, there were 25,000 new claims. And so we are still seeing an extremely high number of folks who are asking to get unemployment insurance for the first time. There were 140,000 people asking for multiple checks as of July 18th. A more update number would be August 15th, there were 127,000. And continued claims for PEBT are about the same, just a little bit less than 30,000 currently. So let's move on to the next slide. And, I should say too that there are still 127,000 people asking for multiple weeks of claims. There's still 30,000 people asking for multiple weeks of pandemic unemployment assistance. And there's still 16,000 people asking newly to be covered by unemployment insurance, even though they're not receiving the $600 per week. Ben mentioned that there is a $400 program. I'm going to talk about that next. But I just want to point out that without that $600 and currently without any additional benefit, folks lost about 2/3 the value of their unemployment check, which meant that they had less to be able to spend on, necessities. And so, almost overnight, $70 million dried up in our economy. Which means that not only are those folks without that money who are directly using those benefits, but that means that money is not being spent and is reducing the ability for other folks to earn a living. In fact, one estimate that I've seen from the Economic Policy Institute showed that if we go a whole year without PUC, the extra $600 per week, then we'll end up shedding about 50,000 jobs in Kentucky, which is enormous. That would be really devastating, especially as we've only just begun to bring some jobs back, as I mentioned earlier. Again, I just want to point to this chart on the right. This is consumer spending in Kentucky, specifically through debit and credit cards. We're now almost 5% below where we were at the beginning of the year, which is much better than that trough there in April, but it's headed in the wrong direction. And so, it is very concerning moving ahead because as people spend less, then that means that there, again, is fewer or less money to be able to keep other folks in their jobs. And we don't want to touch off a vicious cycle. So really what we need is another pretty significant round of stimulus, which includes a large boost that is also dependable as the economy is bad in unemployment insurance. So keeping that in mind, let's move to the next slide. So as many people have heard by now, there was a special program that was created through an executive order by President Trump. And this program essentially provides $300 in federal funds for every $100 that the state provides, for a combined total of $400 per week. This money was, again, taken from FEMA, what is known as the Disaster Relief Fund. And that I will come back to in just a minute because it presents its own problems. But this benefit does not apply to claimants with less than $100 in normal benefits. So, the Beshear administration estimates that about 7,000 previously low-income folks will not receive this. And to be honest, I don't entirely understand why they're being left out. And it's honestly very problematic because you've got folks who are already living on the margins being left out of what is a already reduced benefit. Unemployment benefits can get as low as $39 in Kentucky. $39 per week, and they're only designed to make up about 50% of lost wages. So we're talking about people who are living below the poverty line, now living in deep poverty at a time when there are more unemployed workers than there are available jobs. The state estimates that, again, only about 80,000 people will receive this benefit per week. If you're keeping score at home, you'll notice that there are some math issues here that I don't completely understand, with 127,000 continuing claims for unemployment insurance, 30,000 continuing claims for pandemic unemployment assistance, and in theory, only 7,000 people not receiving it. I'm not totally sure I understand why they think that it will be 80,000 and not more. And that's something that we're going to continue to watch and look into, and hopefully some information will be reported out on these benefits. And then finally, these benefits will last for a maximum of 6 weeks, but it's likely less. So the way that this was written, the disaster relief fund is basically exactly what it sounds like. It's federal money that is designed to help when, say, for example, there's a hurricane or a tornado or flooding or an earthquake or wildfires. And there have been pretty much all of those things in the United States in the last couple of months. So that money is supposed to go to help with the immediate relief in those areas. There is a sort of tripwire in this program where if the disaster relief fund hits $25 billion, then it'll get cut off. And the amount of money that is estimated then to be able to be spent on this program is about $44 billion. So that means that wisely, FEMA is only going to release this funding 3 weeks at a time. We're now 3 weeks out from when this benefit should begin retroactively, which is August 1st. And so, it is likely that we're going to run out of those funds before we get to a full 6 weeks. So if you look there on the chart on the right, this is an estimated amount of PUC and lost wages assistance funding coming into Kentucky on a weekly basis for just unemployment insurance claims. So you'll notice those blue bars on the left. It was a lot of money. It averaged over $100 million a week throughout that period of time. And then you'll see that it drops down very significantly to about $32 million per week with the lost wages assistance program. So not only does that mean that folks are going to be receiving less money who were previously receiving pandemic unemployment compensation, it's also a far less effective stimulus for our economy because it's such a small amount of money. I just want to sort of finish this section by saying, it is better than nothing. I think the governor was wise to take the president up on this. I think our state really needs this funding, and there are folks who are suffering without it. But this is no substitute for a full pandemic unemployment compensation style program. Certainly that's designed to last through the end of the year, but ideally that is designed to kick in as a stabilizer when times are bad. And right now times are as bad as they could possibly be. So we really need Congress to move forward with a robust plan that provides this extra funding just as long as it's needed until our recovery really begins in earnest and jobs have returned to some semblance of normalcy. So with that, I will hand it on to the next presenter.
Great, thanks, Dustin. Hello all, my name is Tyler Offerman. I work with the Kentucky Equal Justice Center. I used to work mostly on food and nutrition policy. Since the pandemic started, I have had to familiarize myself with a lot of the unemployment policies due to just the massive need around assistance for that. Anyone who needs help with food probably also needs help with unemployment. So I just wanted to briefly touch on a little bit of know your rights when it comes to UI and unemployment. And this is because, as I'm sure many of you know, we can talk about the way the policies were written, but how they're actually being implemented on the ground and how easy or difficult it is for folks to actually navigate these systems to get the benefits that they qualify for. Somewhere between a gauntlet and a rat race are probably the best way to summarize them. These systems were meant to tell people no. That's very unfortunate. These systems should be built to support people in their time of need, not to turn them away when they most need assistance. So it's very unfortunate, but I just want to give you all a little bit of terms and information so that you can advise folks to the best of your ability. So the two big terms I want to talk about is good cause and suitability of work. So the first one, good cause, is good cause for separation from your job. So under traditional unemployment, state unemployment, good cause really only meant if you're being laid off at no fault of your own, and then your employer didn't challenge your application for unemployment benefits. Now, with the creation of these new UI programs from the CARES Act, which Dustin already went over, the definition of good cause has been broadened within the pandemic unemployment assistance program. So you'll see those bullet points there. I'm not going to go over all of them, but basically now the state will vet people to see if they qualify for traditional UI, but they'll also be vetting folks to see if they qualify for good cause under PUA. And that is any of these qualifications. Do you have COVID? Is your childcare closed? Is there a quarantine? Has a doctor recommended that you quarantine? So there's a lot of new flexibility within good cause within PUA, but there's also a lot of confusion as folks apply what are the guidelines for interpreting these? The federal government did not give clear guidelines. The state has been trying to set their own guidelines, but there aren't a lot of public resources to show what does qualify as child care being closed and what doesn't. So anyways, I say all that to say there are probably a lot of folks who are confused about if they do qualify, aren't sure if they should apply, or are being denied benefits when they think that they do qualify. So my advice to them is just to seek assistance, whether that's from an employment attorney or from a local legal aid office, which we'll talk about contact information towards the end of this presentation. But the point here is to apply early and then just work your way through, keep on trucking, keep trying to get those benefits. Because right now there's a lot of people who qualify, have applied, and haven't gotten their benefits. Some of them are giving up, and that's really unfortunate because there's a lot of money that they deserve to get and are qualified to get. But getting someone on the phone or just getting someone to resolve their case can be very difficult. The last term that I just want to talk about is suitability of work offer as things open back up. Is the offer of work they're being given suitable? And I would argue, and again, they should seek legal advice. This is just my non-legal opinion, that some people are being offered jobs that are not safe for them to return to. The offer is not suitable. It's not a suitable work offer within the definition of unemployment insurance. So, again, urge folks to seek legal advice, urge them to appeal decisions that they think either, they are pretty sure that they qualified and were denied benefits, or they qualified and are being offered a job back, but that job might not be safe. Or they might still qualify within these new definitions of good cause. So it's all a little wonky. It's all pretty confusing. Even folks that practice unemployment or employment law for years are confused because these programs are brand new and they were built in an extremely short amount of time. So there's a lot of confusion and a lot of folks are getting very frustrated, and that's it's very understandable. But please do refer them to a legal aid program if you have a client that, you know, just needs some help. That's all I got on this one. Great, thanks. And I'm gonna go back to my original job, which is nutrition policy and food assistance. So the SNAP program, Supplemental Nutrition Assistance Program, it's a critical anti-recession program. It's a part of our safety net. It ensures not only that people who are hungry get fed, it also ensures that massive amounts of federal money are injected into our local grocery stores and local farmers' pockets. And for every dollar in SNAP, $1.70 is injected into local economies. So it's, you know, it's really important to ensure people don't go hungry. It's also really important now during the economic, I don't want to call it a free fall since things are a little bit less bad now than they were before, but, you know, we are in a technical recession. So our farmers and grocery stores and small businesses really need as much money coming in as they can get. SNAP is a really important way to do that. Between March and June, about 110,000 Kentuckians qualified or applied for and received SNAP. Again, ensuring that they got food during this recession. There was a slight decline in July, which we chalk up probably, and again, I don't, you know, there's a lot of factors here, but probably to people getting jobs back, since SNAP is based on your income. Once folks start their old jobs again, you know, they might no longer qualify. As was pointed out though, at the end of July, that $600 in federal unemployment expired. So I expect this number to go up again. Just as people had not qualified because they were getting all that UI, and now they may be losing that UI and might not have a job to go back to. So we'll see. As of July, we have about 600,000 Kentuckians who have qualified and are receiving SNAP. And I just want to briefly compare that to the amount of actual need. So in before the pandemic, the Kentucky Association for Food Banks estimated that almost 750,000 Kentuckians were considered food insecure. So 600,000 are getting SNAP, 750,000 before the pandemic were not getting enough food. So there's a huge gap there. And a lot of that number is probably higher, right, since the pandemic, since a lot of people have lost income. So there's a lot of people that still aren't getting their food needs met. And it's up to organizations like ours to ensure that those folks who do qualify for SNAP get that. Largest increases we're seeing in large counties with large populations like Jefferson County, but also counties that are have been suffering with economic marginalization or stagnating economies like Magoffin and Lee County. And a quick point I wanted to make, SNAP is still, of all the federal programs, one of the ones that has the least amount of fraud, less than 1%. However, and unfortunately, people of color are often disproportionately targeted for fraud investigations. So as I said with UI, if you have someone who is being accused of fraud in SNAP, please do get them in contact with a legal aid organization so that they can appeal that and get the support that they need. Next slide. Great. So just a couple quick things, you know, because of the pandemic, there's been a lot of additional flexibilities given to the SNAP program. The first thing I just want to say off the bat, if you or someone you work with has been denied SNAP before, consider applying. There's been, like I said, a lot of new flexibilities. So there is no harm in applying. Emergency allotments have been approved for September, and that basically just means that if you qualify for SNAP, you get the maximum amount, regardless of your income. About 68% of SNAP households should receive some increase because of that emergency allotment. For example, a household of 4, the maximum is about $650. So, now's a great time to apply for SNAP when maybe before you weren't getting a lot, you'll get the max now, at least as long as that waiver is renewed. There was also some flexibility around recertifications. We've basically gone back to business as usual as of today. So if you or your client was supposed to recertify before today, we just recommend contacting DCVS if they don't know when their recertification should be. If they're supposed to recertify from today onward, then it should be business as usual. A couple other things, obviously DCVS offices still aren't really doing anything in person. Self-verification for income, as it's just really hard to get to the bank, to get all the things you need to do that. The SNAP drug felony ban, unfortunately in Kentucky, our legislature has refused to exempt us from the SNAP drug felony ban. So folks with a drug felony have had trouble accessing SNAP before. Luckily, the new administration has streamlined that process to allow for self-verification of drug treatment, AA, NA, those types of programs. So that's great. And we urge those folks who have been denied before for those reasons to go ahead and apply. Work reporting has been waived, and now folks can do some online purchasing with SNAP at least the larger grocery stores. Kroger, Whole Foods, and Walmart, I believe, are the 3. Things that are still needed. I'm not going to talk about PEBT because yesterday was the deadline to apply for PEBT benefits for the spring, for March, April, and May. You may hear some confusing and or conflicting information about PEBT for the current school year. I know that the state has asked for some guidance and flexibility to allow for some PEBT for August and September. The federal government has not approved that request. And really, we're just saying Congress needs to re-up PEBT for the entire school year because there's just so much confusion. Some schools are opening, they're closing, some are in TI, some are, it's all over the place. So we need just recertification of that program for this year for kids that are missing school meals. And then lastly, there is a chunk of folks who are already receiving the max SNAP benefit because they were already in an extreme state of poverty. They're not receiving any increases because of the max allotment. So we are also asking Congress for, to ensure that those folks are also supported during this economic downturn, but there's just an overall increase in the max SNAP benefit. Lastly, just some contact info there to be able to do your SNAP application or to call the hotline to resolve any problems. Next slide. And then just briefly, SNAP is just one of the nutrition assistance programs. WIC is a really important one for pregnant women, families with children under 5. And I want to include fathers in that. A lot of people assume that it's just women and children. If you are a caretaker for a child under 5, you may qualify for WIC. You can do that through the health department. So please do contact the health department. And again, there's been a lot of flexibilities with that program to ensure folks don't have to go there in person. Senior nutrition programs, again, contact your area agency on aging and independent living to get more information or to sign up for those. Kentucky, we have some of the highest rates of senior food insecurity, especially for folks between 50 to 59. And with the inability to visit those folks right now because of them being really vulnerable to COVID, we don't want those folks falling through the cracks and not getting their meals. So Meals on Wheels, other programs like that are really important. Also just consider checking in on your elderly family and neighbors to make sure that they're getting the meals that they need. Meals for children, quick update, the federal government did extend flexibilities for the summer feeding programs all the way through the end of this year. So that's really good. but is still, you know, we still should get the extension of PEBT, even though these meals for children, those waivers were extended. And then lastly, food banks is a critical resource to get folks food immediately. So Feeding Kentucky is a great network of food banks and pantries within the state, and they've got a great contact list on their website to be able to find those folks. So that's all I've got, and I'll pass it off to Emily.
All right, thanks, Tyler. So I want to just briefly share some information about open enrollment and a new campaign called the 123 No Cost to Me campaign that the state has started. We can go to the next slide, Angela. First, I wanted to just remind everyone, you know, what our coverage gains have been under the Affordable Care Act. I thought this graph really illustrates how we had a huge drop in the uninsurance rate, but this is a story that we've told since 2014, and typically we're saying what a great job Kentucky has done, especially compared to other states, in reducing the rate of uninsurance and making sure people have coverage. But it's not equal for everyone. And what you can see in this graph is that primarily white Kentuckians had a much larger drop in the rate of uninsurance and much more drastic. And while, of course, we are primarily majority white state, we have other Kentuckians who need access to coverage and are facing barriers. And it's important that we take a look at what those barriers may be and make sure that we have, you know, systems, policies in place to help people get around those barriers and eventually to eliminate them by having policies that are better than the Affordable Care Act. It hasn't gone far enough for everyone. So what you can see here is that about 21,000 Black Kentuckians are uninsured, and all of this is data from 2018. We know that more Kentuckians have lost coverage due to the pandemic and losing their jobs with employer benefits. But we assume that many of the same disparities remain. And then 24% of our Hispanic Latinx Kentuckians have also remained uninsured and need access to care. So we can go to the next slide. So just to talk a little bit more about Black Kentuckians, and hopefully next month we'll have a similar graph for our Hispanic Latinx Kentucky population. But wanted to just remind everyone that half of Black Kentuckians who are uninsured are working age. Most qualify for some type of public subsidy. So that would be about 8,800, again, based on 2018 numbers, that would qualify for Medicaid, but for whatever reason remain uninsured. And over 10,000 who should qualify for a marketplace subsidy, leaving just 2,000 or 3,000 people who would not qualify for a subsidy and be paying full price out of pocket for their health insurance, or maybe aren't taking up the health insurance benefit offered by their employer. But what we know is that most people have some option, and it may be that they don't know what those options are, have faced some sort of challenge or barrier in getting enrolled and have given up. That often happens. We often talk about, you know, like an unwelcome mat effect. That was especially true whenever we had the Medicaid waiver implementation going on during the last administration, and people thought that they were no longer eligible for Medicaid, or were worried about having to report work hours every month. And it often happens whenever applications are made too complicated, or you know, call centers or offices aren't open hours that are convenient for people, and the phones aren't being answered in time, and people just give up. So what we need are policies that create a welcome mat effect, so that people who are eligible, who have these options, know what they are able to enroll and able to keep their coverage. We can go to the next slide. And while we've had really a lot of bad news today, a lot of challenges that we see Kentuckians are facing, there are some silver linings with coverage right now. So the state recently, actually the governor, a couple of months ago, committed to covering all Black Kentuckians, because as we know, Black Kentuckians are disproportionately being affected by the pandemic, by the virus, working in jobs that they're being exposed to coronavirus more than others. They are, because of historical, inequities and racism, have more chronic health issues that make them more vulnerable to the virus. And then on top of that, if they don't have health insurance or can't pay out-of-pocket costs to get the care that they need, maybe delaying care and not getting the care that they need until it's gone on far too long, and they have are dying at disproportionate rates and also just having a worse health outcomes. And so this 123 No Cost to Me campaign is the governor's way of covering more Black Kentuckians, hopefully all Kentuckians who are uninsured at this point. It is open to everyone, but there's targeted outreach and enrollment happening in Black communities and also in Hispanic and Latinx communities. And so what I want everyone to know, and I've shared this on past webinars, but if Kentuckians are under 138% of the federal poverty level, typically they're going to be eligible for Medicaid and can apply for regular Medicaid, which is 1 year of coverage for most people. And you can click on that link to get to that application on Benefind. For Kentuckians who are over 138% of the federal poverty level, they can typically apply for something that we're calling temporary Medicaid. The state calls it presumptive eligibility. But if you are uninsured under the age of 65, you are almost definitely eligible for this, regardless of income. And there are 2 periods of presumptive eligibility that the state is offering within a calendar year, and each of those can have coverage for up to 90 days, depending on when you apply. So that can get you about 6 months of coverage. This isn't perfect. This isn't, healthcare for all, the universal coverage that we want to see that's permanent, but it is something that people should take advantage of now if they can. And so there are some flyers there that the state has created that are new. You may be seeing campaign ads like this on social media. There are some new commercials that are out there. And like I said, targeted outreach and enrollment. We can go to the next slide. And then open enrollment for 2021 coverage is starting this fall. And I'll have more information to share on our October webinar. But what I wanted to let everyone know is that we have 2 open enrollment periods. There are actually 3. I didn't include Medicare on here. But for Medicaid, people can apply for Medicaid, enroll in Medicaid anytime throughout the year. But what you can do during the Medicaid open enrollment is change your MCO. And this year is going to be a more important year for that because we have 2 new MCOs that are coming into Kentucky. One is actually Molina Healthcare, which has is, I think, in the process of purchasing Passport. And so there may be a little bit more consistency there than there would have been otherwise. The other is United Healthcare. But because we have Anthem and Passport as we know it now, no longer being contracted as an MCO in Kentucky after the end of this year, and these other 2 MCOs starting to cover Kentuckians, people will want to take a look at what the provider networks are, what the various benefits are, and make a decision that's best for them and their families. And they can do that by calling this 1-800 number during November 2nd to December 15th. And if people have questions, need more information, or want assistance enrolling, they can find a connector, or in the case of the marketplace, they could also find an insurance agent by clicking this link at the bottom. And then for the marketplace open enrollment, that's scheduled for November 1st to December 15th. I'm not sure why there's 1 day difference between these open enrollment periods, but that's the way that they've been scheduled by the state and the federal government. And for this particular year on the marketplace, which we're still going to be enrolling on healthcare.gov. I know that the governor announced recently that we are going to be bringing Connect back, which is our state-based marketplace that's seamless, where regardless of your income, you can apply for Medicaid or a marketplace plan with subsidies, but that won't start until next year. So this year we'll still be enrolling on healthcare.gov. There are going to be 2 plans offered, CareSource and Anthem. Or I should say 2 insurers offering plans. I'm sure they'll each have multiple plans. CareSource did get a 4% rate increase approved, and Anthem got a 5.7% rate increase approved for plans this year. The coverage map I linked to, but it is not yet updated for the 2021 plans, but I wanted to make sure that everyone had access to that when open enrollment information starts to come out. And absolutely, connectors and insurance agents are going to be available to help with marketplace plans, and connectors can also help with Medicaid plans. So we can go to the next slide. So one thing I wanted to share, and you may have seen this on social media recently, we are holding some healthcare listening sessions, and this is for people who have been uninsured at any point during 2020. As we're leading up to open enrollment, we really want to understand more about people's experiences being uninsured, what the barriers have been to them. Like I said, it's often people's income and not being able to afford health insurance, but that's not always the case. Sometimes people don't know what the plans or options are that are available to them. And sometimes people have real challenges enrolling in coverage and keeping their coverage and end up just giving up. And so we want to understand what those barriers may be so that we can work on policies to eliminate those barriers and reduce them. We have 2 listening sessions that are scheduled that you can see there: Tuesday, September 22nd at 7 p.m. and Wednesday, September 23rd at 2 p.m. And if you'd like to participate, or if you know people who have been uninsured this year and you think they may want to participate, they can contact Susan Bacino, who is a researcher at the University of Louisville. Her email address is there, and we'll be putting more information about that out. We can go to the next slide. I think actually this may have been my last slide. Like I said, I'll have more information on open enrollment next in October.
Thanks, Emily. I know we're coming up on time, so I'm just going to talk very briefly about the importance of the 2020 census. Please complete it. Please encourage your friends and networks and family members to complete it. Kentucky risks losing $2,021 per uncounted individual. Census enumerators are currently in the field. So if you see them, wave, be nice. I'm one of them. So if you see me, wave, be nice. Just working to make sure that everyone in Kentucky is counted, regardless of immigration status, regardless of whether they live in a rural area. We just want to make sure, and children under 5 are notoriously undercounted. So we want to make sure that every Kentuckian gets counted so that we get all of the federal dollars that we are entitled to. And I'm going to pass it off now to Kara Stewart, who's going to tell us what's happening in DC, if anything.
Hi, yeah, so nothing is happening in DC, so that's a problem. You can go to the next slide. Can you hear me to flip to the next slide? So this passed way back May 15th, months ago. It's good. It'd be great if it could become the law. Doesn't look like that's going to happen, but please feel free to contact people and ask that the HEROES Act pass, because it would be helpful and it would take care of a lot of some of the crisis elements that you've heard reported throughout this presentation. Next slide. This is what's being proposed, currently going to be hopefully discussed really soon. Not all that helpful. Big problem. No money for state and local governments, except for this kind of strange deal with education that's mostly coercive. So we have a not great plan here. But again, we have to have money from the federal government. We have to print the money. I hope that's kind of like a general theme, and we have to make our voices heard to make sure that happens. Next slide. This is just basically for reference down the road. We have to get something passed. We are hitting like a crisis tipping point. I hope that's been clear throughout these presentations. And these are the options that are on the table. Next slide. Man, these slides. So what to do? Lift your voice, share your story, and if you are those grass tops, a lot of folks on this,
please share the story collectors. So KVH has a survey that's got some easy questions about how COVID-19 is impacting your health and economic well-being. And then, of course, KVH and all the members of ThriveKY Coalition and campaign will lift up all those stories and share them with the right folks. So we also have a story map where you can check and see what's already there. And we've got, KSAP has got a specific collector around the unemployment benefit for the $600. So for folks on this call, share those collectors. Let's get people's real experiences, because that's our best opportunity to make a difference. And we will put those collector links wherever Marcy Timmerman is asking for them to be. They are spelled out in tiny font at the bottom. And of course, when you get this whole shebang, you get the live links, because these are live links in the presentation. So that's what we need to do. And if you're feeling like it right now, it's fine to pop off this. Angela, just get the next slide. Like every month, call Mitch McConnell. I'm hoping that's going to pop up any minute. There's his phone number. There's a reference. I hope y'all have got them saved in your phone by now. But keep them saved and make those phone calls. Woo, that one has some formatting problems. So, but call him, you know, call our senator. That link that's in the letter is still right there, but make those phone calls and say, we need them to print the money. We need money for housing and food and for state and local governments that includes Medicaid and healthcare for everyone right now. So thank you all so much.
Thanks, Kara. So I'm not going to share anything about these resources. These are resources that we've shared in the past. They'll be in the slide deck that you'll receive tomorrow. And we'll also put links to those comment collectors directly in the email so that you have easy access to those and can share them with your networks. So thank you all for joining us today, and we will have another update for you in October. Have a good one.